Temperatures are rising, vaccinations are growing rapidly, and COVID case numbers are dropping. Are we about to have more normal spring? We asked Secretary Mandy Cohen on this edition of COVID Uncovered. Thank you again for being with us, Secretary Cohen. You know, I went back. It was just a few days, more than a year ago, when we did our first interview on COVID-19, and very few people really knew about it. Lots of optimism going on right now. People feel like we're turning the corner. We've got 18% of our population that has had at least one dose of vaccine, 10% who've had both shots. What does that tell you about when we might be able to go back to normal?
Well, first, Tom, thank you for a year of really helping us have an opportunity to explain what's going on with COVID. Even the multiple press conferences we do, it's often hard to really dig into some of the science behind what we're doing. So I appreciate the opportunity to talk with you week after week. I know it's been a long year for folks. So, but the fact that we have 3 safe and effective vaccines a year after this crisis start is frankly remarkable. And I'm so grateful to the scientific community for that. And it's, to your point, it's showing in our trends already. So we're seeing our cases go down. We're seeing our hospitalizations go down. We see the percent of tests that are positive is at some of our lowest levels it's been. Now, we're not out of the woods yet. I mean, and that's the thing I need folks to remember. But we are doing a great job getting vaccines out. I'm pretty proud of the fact that we prioritize vaccinating those in our long-term care settings, our nursing homes. We have really seen a dramatic decline of spread of virus in those settings, which is really, really important because that's where our folks who are most vulnerable are. So we are definitely heading in the right direction. However, and I know we're going to get into this, we still have more work to do over the next number of months. I think March is a particularly critical month for us to keep up the good work, and then I sort of see the corner that we can turn in the month of April.
Well, to your point, Gallup just finished a survey. I'm sure you saw it. Nationwide survey. 60% of the people that they surveyed said that the pandemic was getting a little or a lot better. Only about 26% say, 14% say it's getting worse. 26% say about staying the same. I thought that Governor Cooper had a wonderful metaphor at the press conference on Tuesday when he said, we're like the football player that sees the goal line and spikes the ball before he crosses it. We don't need to start celebrating yet. Not too early, right?
Yeah. We have to cross the goal line, and don't worry, there'll be plenty of time to celebrate once we cross that goal line. We're not there yet. And Tom, the reason is that there is still a couple of wild cards. First is how quickly are we able to get vaccine out? And that is not a factor that we have control over. That is simply a matter of supply. If we had more vaccine, we'd be getting out more vaccine. We are limited by the supply we get. And so we have to remember that while we are vaccinating as quickly as we can, you shared some great numbers. We've gotten out almost 3 million doses, about a million people fully vaccinated. That's great. But remember, we're a state of more than 10 million people, right? So we still have work to do. So that's one. But the second is we know this virus is changing. As we do our work, the virus does its work, and its work is to change. It tries to evade our immune system. It evades the viruses, evades the vaccines. And so we have to just be alert for that. What I have not seen that really affect our trends at this point, but we want to be on alert, particularly in the month of March. And I think the more we can keep viral spread low in the month of March and get those vaccines out quickly, my hope is that those variants, those changes in virus, won't get an opportunity to spread across our state. And then we'll be in a better place because we know those variants are more contagious, and we already know COVID's so contagious, are even more contagious and more serious.
Well, that brings up a good point. How prevalent are those variants that we're experiencing? Are there pockets where it's worse than others? What's the situation with them?
Well, Yeah, when we look around the country, there are definitely pockets where it is worse than others. North Carolina so far is not one of those pockets, and I want to keep it that way. I think they're seeing New York, not surprising, New York, California, some of the more densely populated places where there's more travel in and out of the country. They're seeing more of those variants. We are seeing them here in North Carolina, but so far we have not seen them in a concentrated area, and that's good, but we have to keep up that work. Let's keep them low, particularly in the month of March as we get out more vaccine. And that's why I say April feels like that time for me where I really see the corner turning, if you will. We're not going to spike the football yet in April, but the corner turning is really for me in April.
You know, that may be, the governor may have started something, spiking the football.
That's right.
Let me step back
That's
just
right.
a second here, because the last time we visited, I asked you if you could put your fingers on why the numbers of cases, numbers of hospitalizations, percent positive was coming down. And you were a little bit reluctant, saying it was probably a little too soon to identify that. Can you now tell a little bit more about why this is coming down, why we are seeing better news?
Well, I think it's two things. One is we are past the holidays, because we know during the holidays we had a huge spike. So we're coming down off of the holidays. I think that folks are wearing masks much more consistently. And third, the vaccines are having an impact, right? And the more vaccines we get in every single day, that helps us even more. I think just now, though, as we got into the end of February, beginning of March, is really when we had people fully vaccinated. So I think now is when we're starting to really see the benefits of having people be fully vaccinated. And I hope to see our trends continue. I will say that if you look at the trends nationwide for our whole country, there's been a slowing of the progress.
Right.
And so we have to keep our eye on that. Now, North Carolina has not seen that same slowing. We haven't plateaued, but the rest of the country really has plateaued. So again, what should we attribute that to? I think that's the combination of what are we seeing with those variants and how quickly can we get vaccine manufactured and out. So North Carolina is still heading in the right direction. I am noting the fact that the rest of the country has plateaued a bit, and we don't want that here in North Carolina. We want to keep driving that down so we can keep making progress.
Don't want to go there.
That's right.
The percent, I mean, what was it? Yesterday we had fewer than 1,000 new cases reported.
I know.
The percent positive is
great.
down in that 4 to 5% range that you've been wanting so badly ever since this got started. Now, there's some naysayers who are saying, yeah, the reason why that percent positive is down is because we're just not testing as much as we were before. Is that accurate?
Well, we are definitely testing less. I think that's because there are less folks with symptoms and are sick. But remember, the percent positive takes that into consideration, right? It's a percent of the total test. So if you shrink the total test you do, you still that is why it's an important metric to look at in combination with our cases, because I do know we're doing less testing. So are we seeing less cases because we're doing less testing, or is there truly less virus? And I think it's looking at that case number and the percent positive together that reassures me that I think that our numbers are going down. And I would say I think there's also a seasonal component to this. We always knew that there would be, like the flu. So I'm hopeful as we get into more of the spring and the summer, just like flu, there'll be a natural decline in the virus. So we have all the things heading in the positive direction for us. But that's why I said March for me is still a very pivotal month where we have to work hard at slowing the spread of the virus.
On Monday, the Centers for Disease Control released some new guidelines so far as activities were concerned. You addressed those in your press briefing on Tuesday, but let's talk about that a little bit. CDC says if you've had your shots, then you do not have to wear masks in the company of someone else who's had their shots. If you've had your shots and someone else hasn't, it's okay to be with one other person. Elaborate on that a little bit and give us your slant as to how we in North Carolina ought to behave because of those guidelines.
Sure. So first, it's important to know, what does it mean to be fully vaccinated? Remember, for Pfizer and Moderna, that means getting 2 vaccines and then waiting for at least 2 weeks after your second dose. For those who get Johnson & Johnson, the one shot, which is the one I got, it's 2 weeks after that one dose, then you're fully vaccinated. And what that means is you can be around others who are vaccinated, but if you're going to be around people who are not vaccinated, you still need to be careful. So if you're going to be around folks who are unvaccinated, they say really keep it to one household and make sure those people are low risk. And here, it's important to know why, right? Why did they do that? And they said, please keep wearing masks in public. Why did they say that? You're vaccinated. Why do you need to do that? I think it's important for everyone to understand. It's because when we did the research on these vaccines, they only looked at people who had COVID and had symptoms, right? So that were they coughing? Did they lose their smell and their taste? Did they have a fever? They only looked at symptomatic people. They didn't look to see that if you had the vaccine, could you still have COVID but not have symptoms, right? Be asymptomatic. So we still need to understand better, if you've had the vaccine, is it possible that you could have COVID, not have any symptoms, which is good, you're not going to get sick. You personally, you've had the vaccine, you're not going to get sick. But could you still give it to others and not know it, right? That's the important key here, is like we really don't have good evidence to show that being vaccinated keeps you from being able to spread it to others. Now, you won't know that you have it because you don't have symptoms, and that's great. You're not going to get sick. You're not going to go to the hospital if you get a vaccine. However, if you're around other people who are unvaccinated, it's possible you could spread it to them. Now, I want to say, I think that more science is coming out on this to show us that even vaccination is going to cut down on transmitting the virus at all. So that is good news, but we just don't have that data yet. So hang in there as we get more data.
Stay tuned. We've learned lots of new terms during the last year. One of them is the word efficacy. Dr. Fauci likes to roll that word out fairly frequently. Do we have any more evidence about how long this vaccine, after you're fully vaccinated, how long you're protected? Are we going to need booster shots? What's the latest on that?
Well, so obviously we're only a year into this entire pandemic, and so we're less than a year into seeing how vaccines work in the long term. Plus, we know this virus is changing. So I think there are two factors that are going to go into whether or not we have to have a booster. Is this virus changing enough that it is going to evade the vaccine in a way that's substantial and we'll need a booster? We already know that viruses do that. That's why we get a flu shot every year. So this is not new. This is not unique. We get a flu shot every year because the flu changes. It is likely that COVID will change. The question, is it changing fast enough? We need a booster every year. Is it 18 months? We don't know that yet. So that's one question. Is the virus changing? And the second is, what is our own bodies doing in terms of immunity? How long does that last? And I think that's only a time will tell as we go through this. But so far, it looks like we do get good immunity for a long period of time. However, it is the virus that is changing, right? We have immunity to the virus from 2020.
Right.
Do we have immunity to the virus in 2021 is the question. And we'll have to know that as we go forward.
Last week, the states of Texas and Mississippi issued relaxations on their mask mandates. Texas is fully opening all restaurants and bars and so forth like that. Are you concerned that perhaps people in North Carolina are going to see this and feel like they've got permission to relax wearing masks also, and distancing and washing hands, and want to start congregating in larger crowds? Does that bother you? Are you concerned about that?
Well, Tom, it's been a long year, and I get that folks are totally done with all of this COVID stuff and are frustrated and want to get back to normal. And the issue is we're so close, right? feels awful to see more people getting COVID or dying from COVID when we know we have these new tools to protect people with vaccines. So, what I would like to make sure we are doing is protecting each other until we can get vaccine widely available to everyone. And we're not there yet, but I think the news we have seen from the Biden administration in terms of increases in manufacturing, I think we are going to have vaccine widely available by the month of June. So that is not that far from now. So I just think we need to make sure we're being cautious, because I would hate to lose North Carolinians at a moment where we're right, if I'm going back to my football metaphor, we're right on that goal line. You can see it. You're about to cross it. Gosh, I would hate to lose North Carolinians in this moment, particularly when we have ability to protect people. In just a couple of weeks here, we're going to get more and more vaccine each and every week. We're moving forward as quickly as we can. So just hang in there with us. Wear masks a bit more, and trust me, we are going to get to a moment where we can ease more and feel like things are closer back to normal. But let us get vaccines to everyone who wants them first. So I think the summer will feel very different.
The big variable in all of this and how fast it takes place, between hearing what you're saying and reading, is supply. The vaccination, the supply of vaccines. Last week we got 80,000 doses of the J&J vaccine. You had your J&J vaccine. We are ramping up shots. You said yesterday in the press conference that you're getting assurance from the federal government. We're going to start getting even more Pfizer and Moderna in the weeks to come. Is there enough vaccine now? Are we able to handle the crowds? Can we, in fact, deliver vaccines to all of the people that want it?
Not quite yet. Things are definitely improving, and we are actually looking at the numbers right now, Tom, to see whether or not we can move to the next priority group, because for me, that's a really important group we have to get to. It's folks who have a chronic disease that might put them at higher risk for COVID. So they're under 65, but they may have a chronic disease. They have cancer, they have diabetes, they have something that puts them at higher risk. So I really want to get to this group, and so we're continuing to hear good news from the federal government. We also have additional vaccine coming in different channels. Remember, we have vaccine going to every single one of the Walgreens out there, our CVS's, a new FEMA site in Greensboro. So we are looking at the numbers now, and I'm hopeful we'll be able to actually go sooner to that next group, which is Group 4. But
and
then
that's
we still have a lot of folks to get to.
And the Group 4 is supposed to, the way it's planned, open up on March 24th. Do you see anything that leads you to believe we could be delayed from that, or maybe even get to it sooner?
We definitely won't be delayed. March 24th would be the latest. I'm actually looking to accelerate that. We're working with our vaccine providers right now to understand if we can accelerate and go forward. So if anything, I hope to be able to move up that date sooner.
Talk about this FEMA vaccine rollout, this mass rollout. 3,000 shots per day. This is being done in Greensboro. It started on Wednesday. How long do you anticipate this FEMA program to continue?
Yeah, it's great partnership, and it brings extra doses to our state, which I'm very grateful for. So it's been a great partnership between the state and our local partners on the ground here. But yeah, 3,000 vaccines a day. We'll start in Greensboro. And then ultimately, we actually hope to do a couple of other sites. So we'll keep the Greensboro site and then actually do a couple of satellite sites in Alamance and a couple of other locations, just to get even further around the state. So that's really great. They're going to be here for 8 weeks. So
wow.
3,000 doses a day, 7 days a week,
wow.
8 weeks. So that's great. And just another resource for our state. And I'm hopeful that once the feds see how great we are in North Carolina, because obviously we are, that they'll even consider expanding that site. And maybe we can even do more at that site, because we definitely could even scale up further than what we're already doing. So I'm really proud of the team and the work there. I know everyone's worked hard to make sure that gets off. And not just get shots out fair, but we've worked really, really hard to make sure we're reaching the underserved communities.
Yeah, I want to talk about
more than
that in a second.
50% of this. Yeah, so more than 50% of those appointments were held for historically marginalized communities.
So do you have
African Americans, Hispanic, yep.
Do you have to get an appointment for that FEMA site? And if you do, how do you go about obtaining an appointment?
Sure. Yes, you do have to get an appointment. There is an online form that you can fill out, and we'd be happy to make sure that you have all the notes. But you can also call our call center and make an appointment for the FEMA site as well.
So go to the DHHS website. We'll give you information about how to make an appointment for the FEMA site.
Absolutely. Yep, you can go to find my vaccine provider on our site, and you'll be able to get that information.
Very good. You moved into the discussion I wanted to have next, which is people of color, minorities. Early on, and by the way, I don't think people understand, North Carolina was sort of a pioneer in understanding that we were not reaching out to minority groups. We recognized fairly early on we were not serving these minority communities. And I think you told me off the air that Reverend Dr. William Barber helped point that out to you in early January. We are nationally recognized now for, number one, having the statistics on this and keeping up with it. But I think I also heard in this press conference on Tuesday, the governor said, or you said, last week, 20% of all of the vaccinations we gave were to the minority communities.
Yeah, we're very proud of the work, and it's taken a collective effort, and we've had to embed equity into every single part of our vaccine effort. This is not just about education, but it's about actually getting vaccine into communities where it's very accessible. And not only have 20% of vaccines gone into African American arms last week, it's done that for the last 4 weeks. So every week for the last 4 weeks, we have been vaccinating at least 20% of our total vaccines have gone into the arms of African Americans, which is great. They represent about 21% of the population. So we're doing about 22% of vaccines going to them. So that's good in terms of equality, but we're still not there on equity, because we know these communities have actually been harder hit by COVID. And so we know we still have more work to do. And as you were mentioning, the Hispanic community, we still have a lot of work to do there, but we've seen a lot of improvement. We were seeing only about 3% of vaccines going to our Hispanic community. And last week we saw it jump to 7%. So we're making improvements, but we're not quite there yet.
President Biden is expected to be signing this $1.9 billion COVID relief package this week. Can you tell us what's in it so far as us in North Carolina being able to fight COVID? What things about that package give you some hope?
Well, I think it's a tremendous package that allows us to respond, but also to recover. I think this is the first package that is really starting to think about the recovery aspect, and we know that it's going to be long. We know that this year has been hard in so many ways to our business community. It's been hard in the education space and our kids. So I think this is a really comprehensive effort to try to make sure we can continue to respond and make sure we're responding to the crisis in the moment. Also, to build back better, to use that phrase, to make sure that as we're able to recover, that we can do it to make sure that we never get put in this situation again, and that we have the infrastructure to respond to future crises, but make sure that economically that we are also making sure we are strong. I'm particularly excited about all of the provisions that are focused on children and young families in there. Tom, well before COVID, that we had a focus, particularly in my department, but across the Cooper administration, to focus on children and young families.
Right.
I'm really excited in this package that not only are there tax credits for families, for children, which is exciting, but there's a lot of opportunity for creative thinking about how we support children and young families that we're excited to dig into.
So we've got about a minute left. I'm assuming the message that you would like to advance forward once again is the 3 W's.
Of course, right? I said March is an important month. We make sure that we are still keeping the virus level low as we protect each other while we get vaccines out quickly. And when a vaccine is off, when it is your turn, please get a vaccine as quickly as you can. I know you want to hug your family members. I'm so excited to hug my parents for the first time in a year,
right.
more than a year,
right.
Later this month, because we're both fully vaccinated. So get your vaccine so you can hug people again. That's where we all want to be. So get vaccinated when it is your turn as quickly as you can. There's going to be so many opportunities to do that over the next number of months.
Boy, you just, like I said earlier, you just feel some optimism, and there's more to come. We've just got to keep on keeping on for a while. Don't spike the ball yet, as you say. Thank you once again, Secretary Cohen, for visiting with us. We always learn so much when we have a chance to really get you to explain to us in depth. Our next meeting is scheduled to be March 24th, but right now, here's a little bit of a sneak peek as to what you should expect next week on COVID Uncovered.
I don't know where it happened, where it came from, but I know when it hit me, it put me down.
After 69 days on life support, Martin Taylor is recovering after winning his fight against COVID-19. We hear from the Wake County man and learn why doctors are calling him a walking miracle.